All right, we have 12 people in the waiting room. 11:59, just to FYI.
Mhm.
You want to begin?
I'm ready.
Okay.
We're gonna do a quick introduction, or do I just go right
Yeah,
in?
no, I'm going to introduce you and
Just
this.
making sure.
Yep. Denali, you ready?
Yep.
Okay. You want to let everybody in and then I'll begin?
Yes.
Mhm.
Welcome, everyone. We're going to get started in just a moment. If you can, please mute yourselves. Thank you for joining us this morning. Okay, I think everyone is in. Wonderful. Welcome. Happy Wednesday. Welcome to our 4th annual New Year Wellness Series, backed by popular demand and packed with meaningful guidance on spiritual, relational, emotional, nutritional, physical, and mental wellness. I'm Sarah Green, the wellness consultant at the Marcus Institute of Integrative Health at FAU Medicine. Integrative health is a holistic, patient-focused approach to healthcare and wellness. At the Marcus Institute, our physicians treat the whole person by examining everything that makes up a patient's health, including factors that can lead to disease, affect nutrition, exercise, and stress. Ultimately, patients and physicians are partners in healing and wellness. The Marcus Institute is pleased to co-sponsor this series with our friends at the Robin Rubin Center for Happiness and Life Enhancement. We're posting links in the chat now, and we invite you to learn more about the Marcus Institute and the Robin Rubin Center and make plans to join us again in the near future. I am very honored to introduce our speaker today. Dr. Branson Collins is a triple board certified physician who is board certified in anesthesiology, pain medicine, anti-aging, and regenerative medicine. In addition to being a spinal and musculoskeletal interventional expert, he also applies the principles of integrative medicine to optimize the health and well-being of his patients. Dr. Collins received his Bachelor of Arts in Biology at Rutgers, the State University of New Jersey, and completed his Doctor of Medicine at UMDNG, New Jersey Medical School. He was chief resident at Rutgers Robert Wood Johnson Hospital, where he completed his residency in anesthesiology, as well as an advanced fellowship in pain management. He also is an advanced fellowship trained physician in anti-aging, metabolic, and functional medicine through the American Academy of Anti-Aging and Regenerative Medicine. Dr. Collins has served his country proudly as a veteran in the New Jersey Army National Guard. He is a resident of Boca Raton, Florida. In his off time, he enjoys spending time with his wife, Nicole, and 2 daughters. He is also a sports fitness enthusiast and actively practices Brazilian Jiu-Jitsu in the rank of purple belt. I am so honored to welcome Dr. Collins today, and I will hand the mic over so that we can all learn about integrative health and more from Dr. Collins. Thank you.
Thank you so much for the introduction, Sarah, and thank you so much for being with us today. I'd like to give an overview just about how we utilize integrative medicine in our approach to really treating the whole person and comprehensively evaluating anything that comes across our practice. So with this title, be living well and harnessing integrative health for everyday wellness. And really when we look at wellness, wellness is really on a spectrum. And that spectrum includes when people aren't well, right? So when I really address and evaluate people, what I find is that I'm really trying to bring their system into a state of balance. If somebody's presenting with something like rheumatoid arthritis, their immune system's imbalanced. If somebody's presenting with something like irritable bowel, their gut and their immune system has imbalances that we can address at the root cause. And here I'd like to really look at some core fundamental things that we look at in integrative medicine, especially as it relates to inflammation, aging, and then do a case report to really round things out. And I apologize, I do have a lot of slides, but I'll highlight the major points and be available for questions at the end. Thank you. I really like this quote by Aristotle that health is a matter of choice, not a mystery of chance. And one of the key factors that we're seeing in integrative medicine, functional and anti-aging medicine is that really inflammation is driving the aging process, and also inflammation is really at the core of a lot of what we're seeing in healthcare. It doesn't matter if it's cardiovascular, neurologic, even mental health. And oftentimes mental health is not perceived as having an inflammatory contribution. But when we really do advanced testing, when we look at genetics, we do see that there's a significant component of inflammation. Now, this coined term of meta-inflammation or metabolic inflammation really was originally studied in overfed animal models. And what they were finding is that when animals were overfed, that they had a lot of chronic inflammation that was associated with this higher intake of calories. And basically what happened is the signaling of their cell lines really was signaling towards creating a lot of stress on the system and really contributing to the whole system being inflamed or metabolic inflammation. So what do we see with this metabolic inflammation? How does it actually contribute to disease or certain diagnoses? Well, basically what we see is that inflammation will have interactions with nutritional status, that is interactions with the immune system. And if the immune system gets activated and it becomes imbalanced, then we find that we have increased signaling of inflammation, and even leading to things like diabetes, where our pancreas that's supposed to be producing insulin may not produce enough insulin, or may end up having some effects on the muscles where the muscles aren't responding to blood sugar and not responding to insulin as well. And this is really linked with the immune system. And this has very systemic effects throughout the body. So I love this slide. It's in a lot of my talks, but it really shows this interplay between the sources and then consequences of when we have inflammation. So diet is a big part, and we'll go into that in this talk. Physical inactivity, more body composition that's leading towards having more fat than muscle, and disturbances in sleep. And that has downstream effects on insulin resistance, diabetes, heart disease, cancers, mental health, and even neurodegenerative conditions like Alzheimer's, which the numbers have been skyrocketing and will continue to do so over the next decades. So let's talk a little bit about the standard American diet. And the standard American diet, as it stands today, really goes all the way back to 10,000 years in the Neolithic period. During this time, there was an increase in grain consumption and animal protein. And over time, what ended up happening was that as food became less scarce, the caloric consumption became increased. And then over time, there were some imbalances in terms of the intake of potassium versus sodium. And as it stands today, like sodium intake is much higher than it was prior to this period, which contributes to other factors like imbalances and other nutrients like potassium. It also contributes to things like hypertension and even renal disease. The biggest things that we're finding, though, is that as time has gone on and we've had this mass production of food and this rapid turnover of soil, the food itself, even if we're eating perfectly, is less nutrient dense than it was in our history. And then you magnify that with some of the chemicals that are sprayed to prevent certain insects from damaging the crops, and those toxins can actually have downstream effects on people's health. So over time, we started adding more sugars. And what we are noticing is that Americans over time started consuming more red meat, more poultry, more animal products, less plant protein, and also the caloric intake increased from about 1900 to 2660 from the 1950s to today. And when you start looking at how food has been processed, it's been processed with significant amounts of sugar, artificial sweeteners, that we're finding artificial sweeteners may actually increase blood sugar more, mostly because of the impact it's having on gut balance and this gut flora, that really helps us with nutrient absorption and also with our metabolism. Starchy vegetables became more prominent, and um, less and less vegetables, leafy greens, things along those lines were being consumed. Important things for hormonal health, like fiber. Fiber intake started to become less significant in people's daily eating. Americans consume about 15 grams of fiber, which is about half of the recommended level. And really, in men, we really are recommending about 40 grams, and for women, about 30 grams of fiber, which helps with estrogen metabolism, and has impacts on things like hormonal health, breast cancer risk, because it affects estrogen metabolism at the level of the gut. We talked a little bit about sodium, where the average intake of sodium, especially in processed foods, is in the 3300s, which daily goal should be less than 2300 milligrams of sodium per day, which tends towards things like hypertension. A real big one is this balance between sodium and potassium, where potassium really should be consumed in about a 3-to-1 ratio of compared to sodium. And what's happening is that that ratio is now flipped, and 3-to-1 sodium is actually the real ratio that's occurring today. And this has effects on kidney disease. It has effects on neurocognitive function too. And one of the big things that we noted is, as they're starting to look at even these guidelines all the way back from 2005, they were noticing that there was significant depletion in calcium, potassium, magnesium, vitamin A, vitamin C, vitamin E, folic acid, and vitamin D in foods that were consumed. And this is even, healthy foods. So what's happened because of this is there's been this change in terms of um, a more sedentary society, more processed food, more sugar intake, and what's happening is the body mass index and BMI has increased over time. And these are the definitions, but overweight 25 to 30 BMI, moderate obesity 30 to 35, and then severe obesity would be greater than 35. This was an article by the New England Journal of Medicine, which actually did a very broad look, did data analysis on over 6 million adults. And what they're trying to figure out is what is the projections for obesity by 2030. And what they found is that nearly 1 in 2 adults will have obesity by 2030. And they found that with very significant confidence. The prevalence would be more than 50% in 29 of the states, but not below 35% in any single state. Even in states where we have people with good activity, things like Florida, California, still the obesity prevalence will be 35% at least. And nearly 1 in 4 adults projected to have severe obesity by 2030. And this has some stratification to being more significant in women, low-income adults, and non-Hispanic Black adults. So how is this related with gut health? And gut health has gotten a big push in the media, which is great. People are starting to be more conscientious about the interplay between the gut, the brain, and the immune system. And that's something that in functional medicine and integrative medicine, we really treat very significantly. We look at that interplay and treat each in order to help the other and also to optimize conditions. And this looked at diabetes and then checked to see if there's actually some changes in the gut membranes and their integrity. And this is very important because the gut and the brain are very susceptible to having things that are inside in the lumen protected, kind of transmit to the outside. And that's because there's only one cell line of protection between the gut and the blood, and the brain, blood-brain barrier similarly. So this actually looked at the gut in particular and noted that some of the toxins that are in the gut can actually go into the bloodstream and trigger an immune response. And this was just looking at diabetics, and what they noted is diabetics actually had increased gut permeability, which also has effects on inflammation and also has effects on neurocognitive changes and cardiovascular changes. And along with that, the cell energy goes down. There's more stress on the system. And just inflammation throughout the body starts impacting every single cell line. So some of the protective things that we've known about for years really is looking at certain pathways that can help protect the brain and the system from these cell stressors. And things like metformin, actually, which are used for diabetes, actually have some longevity benefits in that they're activating this particular pathway. And also, we're noticing that there's been improvement in nitric oxide production, which is good for cardiovascular health and just vascular health in general. And this has been shown to be protective. There's certain nutrients that we use and supplements that we use that also we find these molecules in food, and one of those is alpha lipoic acid, and that's a really powerful antioxidant that really has been shown to help with heavy metal exposure. It actually can protect the brain and nervous system. It's been found to enhance immune system, improves insulin response to make it so that we're regulating our blood sugar better, also improves the integrity of blood vessels, and also increases our own natural ability to get rid of toxins, and namely in the use of glutathione. The alpha lipoic acid also improves blood flow, decelerates brain aging, helps with other nutrients to be recycled better, and also helps with sprouting of new nerve cells. So and this is all evidence-based in both animal studies, and also we even have randomized studies that are done that I'll show here. So what causes deficiencies? Aging, nutritional deficiencies, some signs of that alpha lipoic acid can be low in somebody. And this is, by the way, something we can measure in somebody's blood in functional testing. We can actually see how much alpha lipoic acid they have. We notice that people who have deficiencies, cognitive decline, insulin resistance, even aesthetic changes where there's more wrinkling of the skin, natural sources, Brussels sprouts, liver, potatoes, spinach, tomatoes. And there's just like anything else, you have to be mindful of side effects and things along those lines, where if you take too much alpha lipoic acid, it can actually negatively impact the thyroid. That's why it's important that people work with medical practitioners that are well versed in the use of different supplements and also herbals, so that we're making sure you're taking the right amount and if that particular supplement is right for you. And this is a study to look at diabetics where it was a randomized, double-blinded, placebo-controlled trial. So this is, gold standard. And they looked at giving alpha lipoic acid. They checked different parameters for blood sugar control, insulin resistance, hemoglobin A1C, and other markers that the system has a lot of stress. What they found is that when you gave alpha lipoic acid orally, it improved glycemic control, help with oxidative stress. And their conclusion is that this may actually be complementary in an approach to diabetes that's helping with the nutritional component. Another very tried and true herbal therapy is something called berberine. This has been found to have antimicrobial activity that was used previously, antibacterial, antifungal, antiviral activity. It actually optimizes some of the fat metabolism at the level of the cell lines, enhances the immune system, increases serotonin, and also helps to improve noradrenaline or some of the excitatory chemicals for the brain nervous system. It's been found to lower blood pressure, lower blood sugar, lower cholesterol, triglycerides, and also improve blood flow. These are things that you have to be careful about in pregnancy, obviously. Some side effects would include constipation, diarrhea, cramping. This was a double-blinded randomized controlled trial that they did for 12 weeks, where they looked at blood sugar control They gave berberine 500 milligrams 3 times a day, and they looked at what's the insulin doing, what's the blood glucose doing, how's the hemoglobin A1C, and then other markers of insulin resistance. And what they found is that the treatment group fasting plasma glucose improved, the fasting insulin also improved, and then after a glucose load, there was actually improvement in how much the blood sugar spiked. And there were significant reductions in the hemoglobin A1C in this population in the group taking the berberine. So these were statistically significant with no adverse effects on other organs. And this also supported the use of berberine delaying progression from prediabetes to diabetes. And that's an important point. A lot of people get this diagnosis of prediabetes. And this is something that, as an integrative health practitioner, I don't even like the label, right? So because it gives this sense that there's this inevitability that's associated with being pre-diabetic. It's like, oh, well, my parents had it, and now I'm going to have it. And in certain ways, that belief system may actually continue to have an effect where some of the lifestyle things that were contributing to that are continuing to be maintained. Very some of the more popular pharmaceuticals nowadays are in this GLP-1 category where they're actually activating this particular receptor. And they're being used significantly in the wellness space, namely because they're lowering blood glucose. They're actually improving the fatty liver to actually help reverse fatty liver and helping with insulin production and also secretion and also protecting the pancreas. And there's this effect on weight loss with the anti-inflammatory effects plus this increased satiety that happens with these kind of agents. They also found that the visceral fat, which is the fat that actually worsens insulin resistance, was reduced in animal models. And then there was an improvement in some of the energy production, as well as a decrease in some of the inflammatory signaling in the use of this. So this is that anti-inflammatory effect. So with longevity in mind and this approach of what we look at with improving health span, one of the things that we've really been looking at is the benefits of caloric restriction. And as we're saying, with this inflammatory change in this metainflammation is associated with increased caloric intake. And there's this saying that the United States is overfed but undernourished for the reasons that we discussed. And when we look at longevity, we look at this pathway called mTOR. And what we want is this mTOR to actually be downregulated. This downregulation of this mTOR is actually associated with improvements in longevity. And when we check people who live to 100, they have a lot of these different markers that their mTOR is downregulated. And a lot of times across all species, decrease in caloric intake has been shown to actually increase lifespan. And with that in mind, they started doing studies where they actually did a fasting mimicking diet, where this particular program, you're actually eating certain macros of calories for over a 5-day period. And they were looking to see, okay, well, what are the effects on this? Can we actually get reversal of everybody's looking for that fat around the abdomen, or most people, a lot of people are looking for the fat around the abdomen to decrease and kind of be more lean there. So they looked at this waist circumference, lean body mass, BMI. They looked at fasting glucose, blood pressure, and also inflammatory markers like C-reactive protein. And what they found is that the fasting mimicking diet, they were looking at this over about 5 to 7 days. And with this particular program, there's 3 cycles of doing this 5-day diet that actually have been shown the most benefit. And they did this in these 100 subjects, and they did comparisons between the control and the people on the fasting mimicking diet, and they looked at them over this 3-month period. So what they found is that one of their endpoints was looking for markers of aging, markers for cancer, metabolic syndrome, cardiovascular disease. And what they found was pretty remarkable in that at the end of the first fasting mimicking diet cycle, the lean body mass, waist circumference, diastolic blood pressure, triglycerides, some of the cholesterol, significantly reduced compared to baseline, just with one fasting mimicking 5-day cycle, without even doing the other cycles. They also noticed that markers for cellular energy were improving. Total relative body fat were improved, and lean body mass was improved. Um, and then when they looked at people who did 3 cycles, they saw fasting glucose improvement, fasting glucose improvement, improvement in lipids, and they didn't in this particular study see any changes in the CRP, which is an inflammatory marker. So the big take home here was that periodic cycles of fasting mimicking are effective in improving levels of metabolic markers, which are risk factors for associated with poor health, aging, and multiple age-related diseases, like we discussed in our earlier slide. And they were looking at doing more studies to really certify this. And I'll talk about this, but this is looking at people who get to 100. And what they did see is that even there's some give and take as it relates to these people who get to 100 years and beyond. And they actually do have some higher inflammatory markers at times. But when they check their anti-inflammatory markers, they're better balanced in terms of the anti-inflammatory markers are actually working very efficiently to balance out their inflammatory markers. So again, some inflammation is actually protective. That's the goal. So they were found to have higher white blood cells, and then higher activation of some of their T helper cells, which help with creating, telling the immune system and working with those B cells to create more immune activity against different pathogens. But what they did find is they had less autoimmunity. They had an improved and better kind of humoral response to when a pathogen showed up in their system. They had better expression of proteins that created better blood flow, and markers for actually improving this, what's called angiogenesis, to actually improve blood flow. And a big thing that they found is that when they looked at their cells and did markers for things like zonulin for their gut to make sure it was actually intact, and looked at other markers for like brain integrity and brain membrane integrity, their junctions were intact. So they didn't have this concept of leaky gut and also leaky brain, which is really tied in with mental cognitive health challenges. We see a lot of that in leaky membranes in Parkinson's, Alzheimer's. So I want to finish out with just talking about how we do this on Monday morning. And this is a patient that we saw. It was a 69-year-old man who came with a chronic back pain as the primary complaint. This happened when he was recovering from a shoulder surgery. Of important history for him, his son had actually died suddenly about 3 months before his surgery. So it was a significant stress trigger that was, in the history there. Over time, since that event, right-sided pain in the thoracic area and this upper back area started progressing, now involving both sides, really extending to the rib cage. Noted that when he didn't sleep well, it was worse. Now he wasn't sleeping well, just because of the pain, and there's this vicious cycle. When he stressed, pain was much higher. And he came in being managed by an outside pain management doctor on opioid therapy with hydrocodone, which he had to take 4 times a day. He said that helped, but it wore off after a couple hours, and he was really needing it 4 times a day. He was doing some osteopathic manipulations, which were helping. He tried and failed a lot of therapies. They tried NSAID therapy like ibuprofens and Motrins, other adjunctive agents, and even tried injection therapy. Nothing was really helping. He did have some exposures growing up, and a lot of what we'll do when we do our history is we go back to childhood history, and we check if somebody has vaginal delivery versus C-section. That has an impact on microbiome status, and also is associated with certain other things that we keep in mind. Exposures to mold, exposures to ticks can have an impact long term on people's immune system, and also if their immune system starts being suppressed, sometimes things that previously were managed, like Lyme exposure, that was previously controlled for, now are starting to show themselves, similar to viral activity. He also had exposure to Epstein-Barr, and grew up around a lot of animals. Had other problems, migraines, constipation, sleep apnea that he wasn't treating, The dental device he was trying to use actually he couldn't really tolerate. His father died early of cardiovascular disease and myocardial infarction at the age of 44, so significant kind of risk there. A busy business owner, standard American diet, was kind of feeding his cortisol with eating a lot of sweets and averaging about 6 hours a night of sleep, but was monitoring. So he actually had some objective data. With his labs, I saw a lot of inflammation. Things like ferritin were high, which is a marker. He was showing that insulin resistance at 6.1, hemoglobin A1C, which is significant. Nutrients were low. Vitamin D was not optimized. He was showing inflammatory markers that were up, and also his B vitamin cycling showed that he was actually having some sluggishness in that system. And then also things like magnesium, which often aren't checked by traditional medicine as just standard panels, was in the low end of normal, which in many ways, in people who have chronic pain, insulin resistance, magnesium being not optimized can contribute to worsening of those things. Otherwise, when you look at his imaging, the imaging itself was really out of proportion with his pain. If you look at the imaging and look at an MRI, it only showed mild changes. So it's always been a big thing for me as a physician. Why is the imaging out of proportion with the presentation? Like, why is somebody presenting in so much pain and discomfort? Because we have to believe that they are experiencing this pain. So the reason is why. And this is what made me start looking at some of these more deeper lab markers, doing more advanced testing, genetic testing, looking at things like exposures. So we treat him very personalized. We had him continue to follow up with the pain management doctor. I started a compounded magnesium that he rubbed into his upper back, so it actually would absorb right in there and act as a natural muscle relaxer, and also has some pain relieving properties. I also got him on a specific kind of magnesium that's good for skeletal muscle relaxation and also calming for the brain. Had him start a multivitamin. We got his insulin resistance really worked on with berberine, alpha-lipoic acid, and also another supplement. Started treating his adrenals because he showed a pattern with low DHEA, which is very important immune modulating hormone that becomes other hormones like testosterone. And when I measured his DHEA, it was almost non-detectable. So we started managing that because I had objective data. I recommended he reevaluate with sleep study because untreated sleep apnea is an independent reason for chronic pain and inflammation. Got him on a good B complex, a high quality fish oil, and also worked on his gut with some vitamin C that actually takes on some of the toxic burden of the gut. And I had him do this vitamin C cleanse that actually cleared out his gut to help him detoxify and gave him NAC, which is another element to help with his liver, specifically because he's on acetaminophen on a regular basis. So that was actually can contribute to fatty liver and also depletes glutathione, which has this interplay between toxins building up, and he's constipated. So I know toxins were accumulating, which doesn't help anything and actually makes everything worse. I also started working on getting his vitamin D levels more optimized, got him on 5,000 international units to get him more optimized there. 6-week follow-up. He was getting a little bit of pill fatigue from the different supplements, and I try to be very mindful about not starting too many things at once, but all these things were objectively needed. And again, when you're treating something that's chronic, you really do have to be aggressive about managing it to help get it better. Muscle spasms were already improving though, which is remarkable. He was still waiting to follow up on some things. I recommended he donated blood because the ferritin was high. He was kind of storing too much iron, which is inflammatory. He had read up on something called a vagal nerve stimulation, where you put a device on the vagal nerve on the outside of the neck and actually stimulates the rest of the relaxed nervous system. I thought it was great. I said, continue to do that. And now the hydrocodone was helping for about twice as long, but he still needed it. 6-week follow-up, we just kept the same plan. I actually started him on a GLP-1 at a low dose for about 4 weeks with a plan on increasing it. 12 weeks later, gut feeling better, muscle spasms mostly resolved, pain improving. He was starting to do Tai Chi and actually doing some movement therapy. Hydrocodone had gone down to requiring 1 pill less a day, which is a win. We based on his oxidative stress markers and things like that, I decided to have him come in for IV Myers cocktail, which has B vitamins and some NEC and vitamin C to help really supercharge his system. And I also started him on a fasting mimicking diet, and then had him just maintain a low dose of vitamin C. 18 weeks later, he had done his first fasting mimicking diet, did great with IV infusion. Reports he feels the best he has in years, lost 15 pounds. Now BMI is 27. A 50% reduction in his hydrocodone use was found. And we started adding in things like sauna therapy to help with his detox. And the plan was to really work with his, continue with that fasting mimicking diet and then follow up with his primary for labs. I thought this was a really good case report showing, one of the interesting things that as I was studying functional medicine, a very well-respected pain doctor posed in this forum. He said, "Is chronic pain reversible? Is it curable?" And everybody said no, except for me. Um, and the reason is from the little that I did know of functional medicine at the time, I knew that there were some really underlying things that we could optimize that for some people, that is the answer to why they're in intractable pain. And, there's still room to move in this patient. We got 50% reduction of his pain
Mm.
and in follow up, more than 80% reduction really over time as I've continued to follow up with him. But it's one of those things where I still go with the goal that all disease is reversible. That's the goal, right? Can we get to that endpoint? Not always. But have we gotten to that endpoint where we've put certain things into remission, where, for instance, chronic pain, we really put into remission? Somebody may have risk factors for it. Autoimmunity, the goal is that we get into some kind of remission where it's silently there in the genes and not activated. We go through our different, personalized approach to get people to reach their health goals. So adopting healthy lifestyles, regular exercise, balanced diet, stress management can ward off inflammation, slow aging. Um, Anti-inflammatory supplements, different spices, vegetables, very important for gut health and also helping with this oxidative stress. And I really encourage people to seek doctors that help you identify and address underlying medical contributions to what's contributing to inflammation and really treating at the core diabetes, obesity, and autoimmune disorders. And thank you for your time today. And here are my references. And there's my email if you have any questions.
Thank you so much, Dr. Collins. It's always so interesting to listen and learn from you. Before we dive into a Q&A, if you can please take a moment to fill out the survey. The link will be in the chat box. That's really important for us as we look forward to next year's New Year Wellness Series so that we can curate programming that meets your interest. So please take a moment to do that, and we'll give just a minute. And then if you'd like to take yourself off mute or raise your hand in the actual Zoom, you can do that and we will facilitate a Q&A for a few minutes with Dr. Collins.
Or even put it in the chat if you're shy.
Perfect. So as we're waiting, I'm going to lead with a question, Dr. Collins. It's one question that I get quite often, then we'll go to the audience. A lot of people don't understand the role of an integrative or functional medicine doctor as compared to maybe a primary care provider. Would you mind providing a distinction?
I love the question. And, all doctors and their doctors, physician extenders, PAs, NPs, all are very important in their role. Primary cares, the role is really to be the center point for the patient in terms of evaluating under the traditional system preventative labs that are covered under medical necessity of insurance. Also, being that central piece to manage sending out to different specialists, whether it's cardiologists, rheumatologists, And then following up with the maintenance and also the preventative measures of making sure people are staying up with their colonoscopies, mammograms, et cetera. Primary cares are very, there's a major shortage, and we certainly need more people doing that service. For functional medicine specialists or integrated medicine specialists, I really look at our field as really a specialty in and of itself of specialist that's able to really look at what your different specialists are doing, whether it's your cardiologist, rheumatologist, endocrinologist, primary care, and kind of filling in the missing pieces. And those missing pieces oftentimes are outside of that medical necessity that drives other physicians to order certain labs or be limited to certain workups or certain therapies. With functional and integrative medicine, we have a full toolbox of looking at genetics, looking at doing special toxin testing, doing special nutritional testing to really see and personalize your regimen to make sure that your individual self is optimized to the best of your ability. And we want to look at your genetics to turn off the genetics that's not favorable and keep that silent. And we want to activate the genetics that's working for us and optimizing our system. So, integrative and functional medicine is really, as time goes on, I think it will really be something that is going to be sought after in terms of people actually doing a traditional fellowship and traditional residencies. And I think it's going to be an extension of the current healthcare system where people will actually have to match into functional medicine because the evidence is there. The outcomes are certainly there. And the expertise that it takes to do this kind of medicine, it's extensive, right? So people that have done functional medicine training, especially ones that have done board certifications, I mean, it's a vetting process of written and oral boards, writing questions for the boards, being really a leader in kind of the healthcare space. So that's the encouragement there is that these functional and integrative practitioners, they can really help each individual to optimize themselves and work well with other doctors so that the other doctors do what they do well, and then we can do what we do well to get people better.
Thank you. Thank you. Next question, and I will just give a quick plug for Marcus Institute. We do offer IV nutrient therapy. We have a question about Dr. Collins' thoughts on NAD for supplementation and IV.
And I see a question from Daniela about Epstein-Barr contributing to chronic fatigue. Can I answer that?
Oh, sure. I was just asking, there was a question about your thoughts on NAD
Oh, sorry
supplement.
about that. I missed that.
That's okay.
So thoughts on NAD. So, and I'm actually okay to go over by about to about 12:55. I have a patient at 1. So if there's any questions that we can get to if people need to stay on. So for NAD is a good adjunct to a lot of regimens. So NAD is actually a cofactor for cellular energy, right? So the goal of the cell is we're aerobic organisms that take in oxygen. We go through a process of utilizing blood sugar. And through that process, we make something called ATP, which is really cell energy. One of the cofactors for this ATP production is NAD. And NAD is really a fascinating molecule in that a lot of what we know about with chronic inflammation and different disease processes is that cell energy actually starts becoming diminished, which some may wonder, is that the cause of the underlying presentation, or is it just the effect, or is it really an interplay between both? And NAD can be utilized intravenously. It can be compounded by compounding pharmacies to actually inject subcutaneously. It can be taken orally. And what it's really doing is it's really helping to support cell energy. There's good research that's being done currently on the use of it in addiction, especially alcohol addiction. And one of the promising parts and one of the challenges with things like alcohol addiction is actually there's depletions in NAD. So then the question becomes, if somebody is returning to alcohol, is it this vicious cycle that they are returning to alcohol because they are actually depleted in NAD and they get this little boost in dopamine to help them feel, this excitatory effect, but they keep depleting their NAD. And when you give people NAD, then it's actually something that may break that cycle. It's also being used in post-traumatic stress disorder. It's also being used in general longevity. So, and what I do objectively is I'll measure to see if there's challenges in the energy cycle, meaning there's certain things that we can test that show that mitochondria may not be forming NAD as well, or maybe NAD deficient. And then when we objectively get that data, then it's actually very indicated to do NAD as supplementation to support that process.
Thank you for
Thanks for the
that.
question.
You want to address the Epstein-Barr question next?
Yeah, I'll address the Epstein-Barr question. There was other ones too, but Epstein-Barr it's a very interesting virus because it's a DNA virus, so it actually embeds into our DNA. And what's very interesting about it is a lot of people think of Epstein-Barr as being transmitted communicably, the quote unquote kissing disease, or kind of having close contact with somebody who had Epstein-Barr and then contracting that and being fatigued and getting over it. What's very interesting about Epstein-Barr is that it actually can be passed on from our parents. And actually, we do not encounter it in the community. But when our immune system becomes suppressed, whether through chronic stress, nutrient deficiencies, Epstein-Barr can reactivate just from our own genetics, which is fascinating that it happens. And then we've actually seen this objectively when we measure people, that there's no other reason for the exposure, but all of a sudden Epstein-Barr markers start coming up very high. So yes, contributes to chronic fatigue. We do know that things like high dose vitamin C, optimization of vitamin D can be helpful in terms of lowering Epstein-Barr burden, and then two, one of the things that vitamin D has an ability to do, and this is why optimization of vitamin D levels are very important, because a DNA virus is actually there in our segments of our DNA and our informational packets. Vitamin D actually will methylate or silence those segments that Epstein-Barr is present. So it actually will silence the segment that Epstein-Barr is present in our DNA to help prevent reactivation, right? So that's where functional medicine comes into play. You can identify objectively somebody's been, has immune response to Epstein-Barr. You can check things genetically, make sure they can tolerate higher doses of vitamin C. You can do intravenous vitamin C therapy, which has evidence for Epstein-Barr. And also you can make sure people's nutrient levels are optimized, and also do other things to improve their stress response, so that you can ameliorate their chronic stress and help to get their immune system in better balance. So that's a great question. There's another question about cold plunging that I'll answer. Thoughts on cold plunging and full body cryo. I think not just I think, when you look at the cold plunging movement, not everybody is a good candidate for cold plunging. I measure a lot of people's adrenal function, especially cortisol, and people who run high cortisol, you have to be very careful, or even low cortisol. You have to be very careful with cold plunging, because cold plunging is a very stimulating, obviously. And some of the theories on it is that it helps with anti-inflammatory effect and recovery and improvement of like mitochondrial function and things along those lines. But because everybody is their own individual, some people, if they have very significant cortisol challenges, cold plunging may not be in their regimen early until you get those things under control. Full body cryo, similar concepts, but there's this aspect of, when we cool the body and we start turning on these survival mechanisms, they're very antioxidant in nature, and they're very anti-inflammatory in nature. So there's some interesting evidence that we still need to vet out.
Okay.
Great question. Thanks again.
Answered it. All right. So Dr. Collins shared his email address there, and you can certainly reach out, whether for clinical services or questions after the Zoom. And if there are no other questions, I think we are going to wrap. We are just about out of time. So I'd like to thank everyone for being with us here today, particularly to Dr. Collins. Thank you all for taking the time to join us for the 4th annual New Year Wellness Series. We hope that you have gained valuable tools and insight to support your health and well-being. Remember, every small step towards wellness counts, and you have the power to create lasting and meaningful change.
Thank you, Sarah. I also want to thank you guys all for spending your afternoon with us. If this was your first day of the series or your fourth day of the series, I appreciate it. I can also put a link for those of you who missed it. Please go to our website and register for our next event, which is really Rhythms of Resilience, a celebration of Black history. It's actually in person on the FAU housing lawn, and it's a drum circle. So it's going to be beautiful.
Thank you, everyone.
Thank you so much.
Thank you.